Welcome to this short tutorial on how to conduct a Covid-19 antibody blood spot test. We understand doing a home blood test might be a little scary, but we're here to walk you through the whole process. Follow these 4 simple steps to collect and test your blood sample. Step 1. Prepare to test. Lay your kit out on a clean, flat surface and make sure it has all been brought to room temperature. Unpack your test device and lay it flat on the table. Now, we need to get your blood flowing. Soak your non-dominant hand in warm water for a few minutes and then do a little light exercise. Step 2. Collect the blood. Dry your hands and use the alcohol prep pad to wipe and sterilise the tip of your ring finger on your non-dominant hand. If you prefer, you could also use your pinky finger. When you're ready, place your whole hand on a hard surface. A hard surface is important as this will ensure the lancet can work swiftly and effectively. Using the lancet, prick the tip of your finger. Don't worry, you won't see the needle and it should only make a small prick. Holding your finger upright and flat, gently massage your hand and along your finger to create a bubble of blood. Try not to squeeze too hard. Step 3. Test the blood sample. Using the pipette, suck up a few drops of blood and then squeeze 1 full drop of blood onto the lower well of the test device marked S. Snap off the top of the buffer solution and carefully add 2 drops of the solution into the same well of the test device marked S. That's it. Grab a cup of tea and wait 15 minutes for the test results to appear. Step 4. Reading and understanding the test results. Have a look at your test device and firstly make sure the control line marked C has changed from blue to red. If so, it means the test was valid and you can move on to the next part. Sometimes the control line may stay blue or only partially have changed. If this is the case, the test is invalid and a new test must be taken from step 1. If your test was valid, now look to the labels on the test device marked IgG and IgM. These are the 2 antibodies the test is looking for. If a coloured line appears in the IgM test region, the result is positive for Covid-19 virus-specific IgM antibodies. This indicates early infection, and you should therefore isolate and follow current government advice. If a coloured line appears in the IgG test region, the result is positive for Covid-19 virus-specific IgG antibodies. This indicates that you have been exposed to the virus in the last 7 to 28 days, but that your body is fighting the virus off. If your antibody test shows you an IgG antibody, this would indicate you are no longer infectious. You may get a result which shows both antibody lines. Since the test can detect the presence of both antibodies, this would indicate that you still have the virus and could still be infectious. However, the presence of the IgG antibody does indicate your body has begun to fight the virus and you could be on the road to recovery. Follow current government advice regarding isolation if this is the result. It is completely normal to feel a little anxious about conducting your blood test, but if you follow the steps in this guide, the process should be a simple and smooth one.